Happening right now as hospitals continue to vaccinate their employees against COVID-19, the state health department is calling the distribution of the vaccine the most significant public health undertaking of our lifetime. Today, health leaders met to discuss how they will continue distributing the vaccine to more members of the public. ADRIANA MENDEZ tells us what's next.
Members of the state's vaccine subcommittee met Tuesday morning to talk about continued plans to distribute vaccines here in our state as more doses are expected to arrive this week. With doses of the COVID-19 vaccine now in Wisconsin, state health leaders met Tuesday to discuss the state's evolving plan for distribution.
This is such an incredibly dynamic and changing situation that anything we do now is going to be outdated within 2 to 4 weeks.
Officials say they will be kicking off vaccine distribution to long-term care facilities in 2 parts, starting with skilled nursing facilities. Health leaders say the Moderna vaccine, which is expected to receive FDA approval later this week, is slated to head to long-term care facilities in Wisconsin.
That will begin on the 28th, assuming that the Moderna vaccine is approved and we receive the allocation that we have been notified. As more doses become available, we can then begin Part B, which is the long-term care, that sort of group of other entities.
With more shipments of Pfizer's vaccine expected this week, the committee also recommends the state track vaccine distribution to pharmacies and other entities to make sure they are administering their vaccine as soon as possible.
That is simply to avoid anyone sitting on vaccine.
And lastly, members of the committee talked about how to vaccinate first responders and whether to incentivize hospitals and clinics that take on the extra task. Reporting in Milwaukee, ADRIANA MENDEZ, TMG4.